The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome to the Women in Depth podcast. I'm your host, Dr. Lourdes Viado. Join me as we explore the inner lives of women, their struggles, fears, hopes, and dreams. We'll go beneath the surface and take a deeper look at what is hidden, unknown, uncertain, and uncomfortable. Hi, and welcome back to the podcast. Today, I am very excited about our topic because it is a topic that I hear many women share as a concern in therapy, and this is the experience of diminished or decreased sex drive in women. And this doesn't just happen in women who are perimenopausal or menopausal. Beyond that stage of their development, this also happens to women of all ages. And so I was very excited to be able to invite a colleague and fellow podcaster, Dr. Nazanin Moali, who is a licensed clinical psychologist and an expert in the psychology of food, sex, and drugs. Her private practice is located in South Bay area of Los Angeles, and she specializes in working with couples and individuals struggling with issues of sex and intimacy. Additionally, Dr. Moali hosts a weekly podcast called Sexology, introducing the most intriguing findings in the psychology of sex and intimacy. Hi, Dr. Moali, and welcome to the podcast.
Hi, please call me Nazanin.
I will.
Thank you so much for having me. I love your podcast, and it's truly an honor to be here.
Oh, thank you so much. I was planning to say Nazanin because I think it's a really beautiful name, but I wanted to start off with Dr. Moali.
That's very kind of you. Appreciate that.
We have our topic that I want to delve into, but before we do that, I wanted to ask you a little bit about, your work as a sex therapist, because I feel that to many people that is a little bit mystifying and intriguing. And so if you could share exactly what does a sex therapist do and what kinds of struggles do people come to see you about?
Great question, because that's my experience as well, that when people call, first of all, about therapy, there are so many misconceptions, stigma, and also added to that when the issues around sex, people are more kind of nervous to reach out and get help. So sex therapy is a form of psychotherapy, which is a talk therapy. There's no touching involved. Fully clothed, and this is an opportunity for people to come in and explore their issues around their sexuality, relationship dynamics. At times, people are in therapy because they want to improve things, and at times they're coming in because there is something going on that's not working for them. People can seek therapy, sex therapy for themselves. Again, many women who are struggling with low sexual desire, issues around reaching orgasm, painful intercourse, hosts of different things, and also couples that when there's mismatched libido, there are issues going on in the relationship that they want to address or they want to improve their sex life. I'm so passionate about this work because what happens is I struggle with some issues around sexuality and sexual dysfunction when I was younger. And I always been in therapy myself. And I was going to someone who wasn't necessarily specialized in sex therapy. And although I love the work we've done together, but then I started seeing a sex therapist who was teaching me specific tools and techniques. So usually sex therapy is more kind of solution focused. Sex therapist teaches people specific practices, tools that they can use in order to reach their goals.
And your work is so important because I think that since, even though there's so much overt sexuality that we see outside in the world and at least here in the U.S., it's still very much a topic that I think many people, it's something they don't really want to ask even their close friends about. It's not something they're comfortable, maybe even acknowledging to themselves. And I would feel that your work is probably so normalizing in some ways. People can feel there's nothing wrong with me, that this is common, or there's a solution. Does that make sense?
Yes. And similar to what you were telling, one of my favorite thing is people kind of at times they assume they're broken. Because some of these issues around sexuality been there for years and they haven't talked about it. And when they start therapy, because this is something that they haven't explored, people can see progress quickly and they say, oh my God, then it didn't mean that it was broken, or that's not normal. And they totally change their understanding of themselves, and not only around sexual relationship, it can impact people's confidence. And that's one of my favorite things to see, that people, their confidence level change when they address some of the challenges.
Yeah, that's wonderful. And I know that you have to be very gifted in helping, your clients to feel comfortable talking about these sexual struggles or these concerns that they bring in. So thank you so much for this work that you do, because it's necessary, it's needed.
Appreciate that. Thank you, Lourdes.
And so today we're going to be talking about an experience that actually many women struggle with. And I may not even be using the correct terminology, so I will welcome your teaching in this. But the way that I hear it from clients, colleagues, friends, family members, is this is no sex drive or low sex drive, or just, not really enjoying the sexual experience. I know Nazanin, and she's a sex therapist, and this is perfect for a topic because, again, our audience is mostly women, and this is, I think, a common experience.
Right. And I notice it as well a lot in my practice. One of the main issues that I see, as you said, people are coming in with low sexual desire, and there are whether they're coming in themselves or with the couple. So yes, I agree with you. That's very common.
So, is there a criteria? Is this something that you diagnose, and how does someone, I guess, discern if what's happening with me is actually something that's a concern, or it's just something that is just a phase? Does that make sense? It's not really an issue. Where do you start with this?
Great questions. And, definitely we have a diagnosis for it. And our DSM, for our listeners are not familiar, that's the main diagnostic book that therapists, psychologists, psychiatrists use for diagnosing people. But as similar to many other challenges we have, you might struggle with low desire, but you might not meet all the criteria for kind of what would be considered medically diagnosable. So the way I explain it to my clients where they're coming in, I talked about, okay, where are you with level of desire? How much desire you're experiencing in day-to-day life around sexual intimacy when you're with your partner, and also your sexual fantasies could be part of it. And I think big part of it is how much does it bother you that this is an issue for you, if that's an issue for you. For example, I have clients that they say, I want to address it for my partner, but when we get to kind of assessing, it seems like this is a concern more for a partner. So it's more of a mismatched libido, one partner having higher desire and the other partner having lower desire, and there's nothing wrong with it. That's been their baseline. The way I talk about the kind of understanding where you are with your desire is I'm telling my clients, kind of imagine you're on vacation. There are no stressors, nothing going on, perfect scenario. How often would you want to have sex? And we talk about how is it been the same in the past for you, or it's a sudden change for you. For example, I have clients that they say, past 6 months, I haven't been experiencing sexual desire. I don't fantasize. If I used to do masturbation, I don't masturbate. I'm not able to experience sexual desire when I am with my partner. That's really bothering me. But I think what I want to emphasize on, what matters most is how much this is important for you, how much distress this causing in your life. Because I think sexuality is an important part of ourself. And if that's something that's struggling, I don't want people to kind of say, it's not important, because I genuinely believe like pleasure is one of the most important aspects of our life. And it's important for us to have kind of experience that, and we have a good experience around sexuality.
That's so fascinating, Nazanin, because I had honestly never heard of the concept of the mismatched libido. And I can, I can imagine that is very reassuring for couples to hear that it's not that there's something wrong with either of them, that it's just a difference in how they experience that. And I also like the focus on how much distress this causes for the individual. And I think in this time where we're all very busy and there's a lot of distraction, I think it's so important to bring that attention back to the importance of pleasure, feeling good and enjoying yourself sexually.
Exactly. And along the same line as you were talking about it, this is a time of high stress for all of us. APA released this study, I think in 2013, that it talked about 1/3 of population experiencing acute stress, extreme stress on daily basis. And if we are so stressed out, it's hard to be in tune with our sexual desire. And we're going to talk about different model of sexual response. But you're right, in life, there's just so many things going on currently that might cause us to be not in touch with our sexual selves.
So there is a correlation or a connection between how stressed out a person is and their desire for sexual contact or sexual experience.
Absolutely. Let me tell you a little bit about dual control model of sexual response. You might be have some awareness of it, but I think it's really helpful for people to kind of conceptualize how are these things are related. So in this model, to talk about it against one of the well-established model of sexual response, that we all have what's considered sexual facilitators, and research are talking about it as excitation mode, and we have inhibitors, which they're talking about it as in research and inhibition. So the way that Emily Nagoski, one of the well-known sex therapists, talking about it is, imagine these are the brakes and accelerator pedals in your car.
Okay.
Sexual facilitators are the gas.
Okay.
So these are in the environment that could be arousing. So sometimes I hear from my clients, it can be their environment, things in the environment that's arousing to them, things in their partner they find they're arousing at time they're talking about it, music that's playing. And, most of the time, at least, I don't hear, and I know research shows that the accelerator, the gas pedal, is not an issue. The issue is that our brakes are on. So brakes can be things in the environment that prevents us from experiencing sexual arousal. So it causes things to not be just right. For example, if we have lots of stress and our brakes are on, no matter how hard we're pressing on the gas pedal, the car not going to move, and our sexual arousal not going to move because of the brakes. Some of the common brakes are stress, could be relational issues. So if you have a struggle with your partner, you don't like the relationship you are in, that can be a source of a kind of a inhibition for you. At times, guilt and shame around sexuality can be a brake. And again, these low desires could be something that kind of starts from teenage years because of you being exposed to sex negative messages in religion, in media, from the family of origin. So there are a number of different things that could be brakes. And I always encourage my clients kind of take a look at it. What are some of my accelerators and what are some of the brakes? And what can I do to remove the brakes? And I think that's where people can see most changes.
That's fascinating. I love that, just the metaphor, the brakes and the accelerator. And It doesn't matter, if you have your foot on the accelerator down all the way, as if the brakes are on, you are not able to move forward. And, when you were describing some of the examples of brakes and you were talking about the environment, I was thinking, I think being a new parent, having young children.
That is so true.
That's a definite break. And then I also wanted to ask you, you mentioned guilt and shame that can come from messages that we internalize from our childhood, from our environment. Can traumatic experiences act as a break?
Absolutely, because what happens is we need to be experiencing emotional safety in order for us to experience arousal. For example, if we've been chased by a lion, sexual arousal is not a priority for our body. So our sexuality is shut down and we start running and all of those kind of activating things start working. So the same thing when we experience trauma, that can be a huge break because it jeopardizes our safety. And it's hard to get into. You need to be in optimal mode of relaxation and arousal in order to be able to experience desire, experience sexual satisfaction. And when your body gets overwhelmed with cortisols and you're feeling that like you're feeling hypervigilant, it's hard to experience the sexual arousal.
Yeah, because you're just so not in a state of relaxation. I mean, you're just, your body is on alert, like your body's preparing for a threat versus a pleasure.
Absolutely. And I think at times it happens so often for people that becomes a normal when they had such a kind of traumatic experiences, that because so many people, they don't talk about it. What they want is to put it behind and move forward. And our bodies, as you know, remember, and it's just hard to get into this optimal mode of relaxation and experience sexual arousal when we are in a kind of hypervigilant, activated phase.
So can something be both a brake and an accelerator? And what I'm thinking about right now is pornography.
Yes. So as a sex therapist, I want to be honest with people. I'm not against pornography. What's happened is I tell my clients to think about it as a fiction. The same way if you're looking at the romantic comedy movie, you're not taking notes about what the relationship looks like. And porn is not a good depiction of what our sexuality look like. Because at times, one of the challenges that many women experience is that my sexual arousal response is not similar to what I see in porn. In the porn, there's like 5 minutes of foreplay, if anything, and then they move to penetration and the woman instantly reach a climax. And that's not how most people's experience is. And that gives people kind of this information about, oh my God, I'm broken. Something is wrong with me. And also, if that is the expectation of the partner, that adds another level of pressure. But the way it can be an accelerator, one of the challenges that I see in unfortunately women of all ages is that the guilt and shame around sex. So they're telling me that, when I was young, my parents told me like good girls, they don't think about sex. So they learn to suppress their sexual arousal and sexual thoughts. So one thing that pornography can do is helping them to get in touch and curious about their sexuality and their arousal. With women, at least the women I see in my practice, one of the challenges is the depiction of women in porn. Many women, they cannot see themselves in those actors and actresses. So what I actually find helpful with my female clients is they love usually erotica. So it gives them that kind of a stimulation that activates that part of their kind of like their erotic template so they can explore and be curious. But they don't necessarily kind of get exposed to things in pornography that can be source of break. It's funny, when I started sex therapy, one of my naive recommendations for one of the women was like, okay, go try to kind of explore different things, watch movies and see what you like. And of course, when you're new to this, she just Googled things, and the images she saw was so traumatic for her in a sense that I was like, oh my God, I didn't know that genre exists.
Oh my goodness.
So and we worked through it. But again, if the thing that you're seeing is not matching your erotic template, that can cause a huge break.
When you talk about an erotic template, this sounds like your ideas about or your beliefs about sexuality and what that means for you. Is that what you mean?
Yes. So
Okay.
we all have a different erotic template. The way we talk about it in sex therapy is like our fingerprints. Every two person have the same fingerprint. So it could be kind of emotions that you find erotic. For some people, love can be feeling loved or feeling adventure or excitement. So could be the emotions that are arousing for you, could be images, could be situations. So number of different things, that the combination of things that create this optimal experience of feeling sexual arousal.
So when we have, for example, like I'm not sure if this is the same. The mismatched libido is not the same as perhaps like a mismatched erotic template then, or you could have both going on.
Yes, so we can have both going on. So what happens is, so I was telling you about the women, like sometimes we're not just in touch with our sexual arousal, we learn to kind of suppress it. So at times, one of the recommendations I give, like back the porn thing, is just for people to do things to cultivate the sexual desire. To the mismatched libido point, is these are the couples that when they're coming in, there is one partner that always had higher sexual desire. They, like perhaps when I asked them about the vacation sex, and I asked these questions in front of couples, and one says, I would have sex every day. And the other partner always said, like, oh my God, I would never want to have sex every day. Maybe for me it would be once a week or once every other week. There isn't necessarily anything wrong with that. It's just like people being at different places with their sexual arousal. Similar to, I always kind of compare it to our appetite. Some people, they like to eat 3 times per day. Some people eating 5 times per day. So it doesn't necessarily mean like one person is right or the other person is right. It's just our physiological response or psychological response. But people who have mismatched erotic templates, they might say, we both say, we want to have sex every day. So one person's idea of great sex, idea of having a great sexual experience might entail a BDSM, might be things like, might be related to kind of experiencing different kinds of what we consider quote unquote kink behaviors. And one partner just might be interested in more what's known as vanilla sex, something like kind of sex that's connecting. They both might want to have the frequency would be the same, but the content, what they find arousing, might be very different. And what's great is that most people, they don't about the perspective of coming to sex therapy is that most people, they never talk about these things openly with their partner. So they're just going based on what they guess that the partner likes. So when they are in therapy and sex therapy, they can talk about this openly and they can examine and find something that might be arousing for both partners or learn ways to accommodate each other's desires.
It's any wonder that any of us managed to, have the matching erotic template and the libido, because I was thinking, with your example of the appetite, how often you like to eat and what you like to eat, that would be almost like going to lunch or dinner with someone and just hoping that, they want to eat at that restaurant at that time, that maybe they don't eat lunch. It's just
right.
It's amazing that we managed to somehow, I guess, find the alignment sexually with our partners.
Right.
This is just so fascinating.
Right.
So when it comes to women, again, going back to the breaks, and you had described like guilt and shame are fairly common for women. Are there any other breaks that you see women typically coming in with? Like this is something that's getting in the way?
Yes. So one other kind of breaks are mental health challenges. It could be totally not related to your partner, but I had female that they have struggle with OCD, and they're constantly preoccupied with obsessional compulsional thoughts during the act of sex. And it's just hard for them to get into rhythm of feeling aroused and being engaged with their partner sexually. And as me and you both know, that depression is another huge break, because when we're depressed, we don't experience and get pleasure from the things that we used to get pleasure from. So it's just all around, everything looks gray and gloomy, and at times people are coming in saying that I don't find sex enjoyable, and we get to it, they're struggling with depression, and this is one of the symptoms. Speaking of other breaks, hormonal changes can be a huge break. That's why when people coming in, I often refer them for doing a medical evaluation, complete medical evaluation, because at times these hormonal changes in our bodies impacting our arousal. So that would be something else that can kind of cause issues. That would be one of the breaks. Another huge break that I see is issues around self-image. People feeling horrible about their bodies. They don't want to share their bodies. They're feeling shame. And that can impact their experience of arousal because they don't experience themselves being desirable. So it's hard to kind of experience the desire with the partner.
So you can imagine, perhaps, a woman who has internalized sex negative messages and then perhaps is dealing with depression and does not feel good about her body, and then is also dealing with hormonal changes. I mean, you have right there, I think, what did I count? 4 or 5 breaks, right?
Right.
So I can see that obviously the treatment plan, the way to move forward is going to be very different depending on what the breaks are. But for example, if it is hormonal changes and they do the medical eval and find out, yes, this is what's happening, what's the course of treatment for that woman?
So first step would be referring them back to their physician so they can get their hormones issues addressed. At times could be kind of getting estrogen creams, could be diet things, could be number of different things. So I guess first step would be kind of identifying what are some of those breaks, and then like referring out for medical kind of piece of it to the physician. But the other piece, I think about it as a kind of peeling different layers of onion. So we start where is the most pressing things. One of the interventions that I love and that's very impactful is coming from the research of Dr. Lori Brutto on implementing mindfulness. So I always recommend people start practicing some kind of a mindfulness practice in their daily activity. Because what happens when we are kind of having all these breaks that are going on, we are feeling distracted. And it's just hard to pick up sexual cues. So I think in her research, she found that she talks about minimum of 15 to 20 minutes time around mindfulness, kind of doing some kind of a breathing exercise, anchoring yourself in your body, kind of noticing what's going on. And that can be very impactful long term. Of course, if trauma is an issue, that might be something that you have to address differently, because at time with mindfulness kind of meditation that people can get flooded. But for most of people that are struggling with different kinds of day-to-day breaks, like distressors or feeling overwhelmed, mindfulness could be one way of addressing it. Then after that, I would go to what are the pressing issues that the woman who's coming in, that they identify it's a bigger break. If it's a sexual shame, what we can do to reduce the shame, kind of like exposing people to like providing them with the information that's kind of provide them with the positive outlook around sexuality. For example, if they want to watch porn, what's considered ethical porn, that like female friendly porn that they can watch. We talk about different ways for them to cultivate and get in touch with their sexual self. Again, if it means going like reading erotica or keeping a journal of your sexual thoughts, or it could be doing things that make you feel better about your body. As someone who works with clients who are struggling with eating disorders, I don't think at times dieting would be a solution for most people, because what happens if you didn't like yourself at a certain weight, losing another 40 pounds, 50 pounds, most people, it doesn't feel if the issue is like self-worth or issue is deeper than that. What I recommend is kind of doing things to get in touch with your body. For example, like getting the clothing that makes you feel confident, that you find sexy. You don't, for example, I have clients that they're trying to kind of overcome the low sexual desire that they're experiencing after giving birth to child, and they're talking about their body changes, and they're trying to wear the lingerie that they used to wear like 4 or 5 years ago, and that in itself, and they're trying to get into these clothing, brings up all this source of like breaks. So getting things could be lingerie or day-to-day clothing that make you feel good about your body. So these are some of the things that comes to my mind. But of course, you need to address the deeper issue of if sexual shame is an issue, where did you learn it? And what can we do to help you have a better relationship with your sexual self?
Wow, it's, what I love about this, Nazanin, is that there are really a lot of solutions. There are a lot of things that the individual can begin to do to take the foot off, many of these breaks. And also, I love how you described that you focus first on the biggest ones, the biggest breaks, and then you go from there.
Right, because if it's all about small wins. So if you feel like, the more you're moving forward, of course, with psychotherapy, we know that it can take a while in order for people to address all the issues, but kind of addressing one by one, removing the stressors, people can see profound changes in their sexuality.
Yeah, and just feeling that that sense of movement, of progress, of accomplishment, that's very encouraging, and I think helps someone to feel that they are able to change this.
Right. And how common it is. One of the research studies I was reading said, I think it was half of the population at one point in their life have some struggles around their sexuality. So so it's half the general population. And we're not talking about it. And it's just shocking to see we all are struggling at one point or another, at least half of the population, and we're thinking we're alone in it.
So I think I know what you will say with this, but I have to ask, is the struggle with low sexual desire also common or more common with men than women? Or what have you seen, or what does the research say?
I don't know exactly the numbers, but yes, of course, I see male in my practice that struggle with low sexual desire, and the stigma that comes to it. That's another break for them. I see at times couples coming in, and men are the part of the equation that struggles with low sexual desire, and the shame that they're experiencing because of that. They're talking about, in the society, the way that men are portrayed is we want sex all the time. And if you're not fitting that image, there's something wrong with you. And I see number of couples that coming in because of that issue. And the breaks could be similar for men. I had male clients in my practice that when we get into it with the couples, the male partner share with me there was this sexual assault experiences as a child, and the stigma associated with that stopped the male partner to report that, and now they've been sitting on that for years. So of course both partners can struggle with low sexual desire, but I think the way that's been portrayed in media, that the women are usually a low sexual desire partner not wanting sex, and the husband, boyfriend, male partner want to have sex.
Yeah, I can see how that can be so that just adds another layer of difficulty, another break to the experience for men. And, just like I think women deal a lot with the stigma of what it means to be a sexy woman. With men, it's, what does it mean to be a man, and how does that sexuality play into it? And they're, being this viral man with a lot of sexual prowess, that's the myth anyway.
Right. And how, media constantly feed into this image of man that's all he wants is sex, and you need to be sexual feeding, certain kind of image versus the talking about it's not sexy to be vulnerable and all of that. So those are other issues to couples when they're trying to address their sexual kind of mismatched libido challenges.
Wow, this is so fascinating. There's so many layers to it.
Absolutely. I love it because it can be something that you can address in few sessions, or something that could go the more we're peeling out the layers of onion, the more we describe and the more we discover, which can be very interesting.
Is it surprising to the clients you work with when you begin to peel the onion and these different breaks are revealed?
Absolutely. It's just so interesting, especially, some of my male clients, they never thought about these things. And when we're talking about it, it's oh my God, I don't know that was related. And similar to my female clients, they think about, I never thought that is something that can be related to my desire, and addressing it can remove the issue. So for example, one of the kind of a common experience that I see is that, as we were talking about it earlier today, that most people got their sexual education from porn. So they don't know about 20/20 rule. So one thing that we talk about in sex therapy is the 20/20 rule, which is of course a rough estimate of you need to engage minimum of 20 minutes of foreplay. Penetration, having kind of some kind of a sexual experience. And I get my female clients, when we're talking about it and they're implementing it, they say, oh, wow, I had no idea. And I can experience sexual arousal. It might just take me longer. And this reminded me of another concept about sexual response experiences that some women have. In Masters and Johnson, they talked about people usually first experiencing arousal and then other things follow through with kind of climax and all of that other stages. But many women, and studies show that they have a responsive model of sexual arousal. So what happens is they don't experience arousal, but when they get presented to things in the environment, when they start foreplaying, at times they get into it, they experience arousal, desire, and there's nothing wrong with that. It's just a different model of experiencing sexual arousal and desire. But at times, because of, this kind of expectation that couples have that every single time that we're starting with foreplay or we're going to have sex, it would be hard for women to give it a shot.
Wow. I'm just thinking too of, all the myths that perpetuate this, as this idea of all women need a certain amount of foreplay before they can have sex, or that men don't need foreplay. They all are ready to have sex. It's just right. I think back to what you said earlier about the fingerprint, and everyone's sexual template is so unique. And so having these conversations and, exploring the breaks, it really can, I think, normalize things for your clients and help them to feel hopeful and optimistic and able to make the changes to experience, the type of sexual experiences that they desire.
Right. And at times, the biggest revelation for couples is when they have a conversation about it. Could be in our offices or with themselves, with their partner, about what they like, what their erotic template entails, and being able to give them space and opportunity to explore these things in conversations. So I think, yes, that can be also a very powerful tool.
So what happens, Nazanin, if you have a couple where they have very different erotic templates, and perhaps there is a fear in sharing what one's template might be, what one's fantasies might be, because perhaps, their partner would be shocked or disgusted or does not want to engage in the same type of activities. How do you recommend that couples negotiate that?
I think you're exactly on the point with that at times when I assigned couples in my office to share their sexual fantasy with each other, I feel this hesitation. Most of the time, at least, between the couples that I see, among the couples I see in my practice, the experiences and fantasies they have is a common fantasy, and their partner wouldn't be getting shocked about it. It's just their fear of showing vulnerability. But at times, again, depending on the content of it, I have clients that they have the kinks that are not necessarily common. For example, if they have like adult age play or could be certain kind of fetishes, I would recommend to kind of maybe exploring it with a therapist and seeing what would be the best way of addressing it. If that's something that, again, it's part of what's not considered quote unquote mainstream, and kind of like bringing it up with the help of a therapist. But most sexual fantasies, erotic templates are common. So what I do is I give people at times this assignments of, okay, write down your sexual fantasies, and you can have different times during the day. Let's start with the things that you consider more kind of quote unquote common or less threatening to share with your partner, and kind of take turn read it to each other. And it's just like 15 minutes one partner reading, you're engaging, and 15 minutes the other partner sharing, and it's just a matter of talking about it. And I assure them that this doesn't mean that we're gonna act it out. We're just having a conversation and kind of hearing out what our partner likes. Most of the time, our partner loves and cares about us, so we can share those things with them. At times, I think barrier comes from within, but again, during the years, I had clients that they had fetishes that their partner didn't know about it, and they needed some more support from therapists about coaching how to say it. And at times, I am sure other therapists facilitate that conversation in the room with their partner. One other non-threatening way of doing it is I ask them to go through, these are the lists that even when people Google it, they can find yes, no, maybe kind of lists. So it includes all sorts of sexual behaviors. Some of the one that's just very common one, penis, vagina penetration, or it could be very kind of less common ones. So each partner takes time to mark the one that it's absolutely yes, they would love to explore it, and things that they kind of think is absolutely off limit. And you can put some maybes on. So maybes are the ones that you might be willing to explore it under certain circumstances. You're not committing to it yet as a yes, but there is a maybe that, okay, I might be open to this. And in therapy or between themselves, they're sharing this list. And even with doing that, people discover things that are arousing and exciting to both, but they haven't talked about it. So that would be another way of non-direct way of assessing where is our partner compared to where we are as far as our erotic templates.
Wow, this is so helpful and fascinating. I'm just amazed. I've really learned so much from you today. And I love that, just the normalcy, when you said at any given time, 50% of the population, which, clearly lets you know that low sexual desire, crosses all genders, crosses all ages, crosses all ethnic groups. I mean, it's something that is very, very common. And just, the metaphor of the breaks also, that really helps, I think, to see the problem as not within the person. You know how many times people come into therapy with a sense of, as you mentioned earlier, that I'm flawed, I'm broken, there's something wrong with me. And this clearly shows, well, you have the accelerators going, right? That's working, that's there, but there are just these brakes. And so of course the vehicle can't get going. So I just love that way of framing the challenge and the solution. it's very, I think, empowering for the client, for the person.
Right. I appreciate that. And also other thing related to accelerator and brake is that our sensitivity could be very different. Some of my clients, they have very sensitive accelerator, but they have sensitive brakes as well. So they might be able to get excited, but then things in environment quickly can shut them down.
Wow,
or I have clients that, they have a very strong brake and their accelerator might not be sensitive. So it could, as you said, we all are so different and it's normal to be different. It's just a matter of finding the ways that help you to optimize your sexual desire and have a sexual relationship that you want to have.
Yeah. I was thinking to myself, I was laughing. I said, so this is why, vacation sex is so easy,
Right. Because there's no break, hopefully.
Hopefully, yes. I was thinking about that. I was like, what would be a break of vacation sex? And I thought, well, maybe even like the pressure that, okay, we're in this, beautiful island. It's a romantic evening. I can see how that pressure also could actually turn into a break,
Right. And being in bikini all day and feeling comparing your body to other people might not be the best for activating the accelerator.
Oh, thank you so much, Nazanin. This has been a wonderful conversation. I'm very excited to share it with our listeners. If there is someone right now who is thinking, okay, I would like to find a sex therapist to get some support in either, helping with decreased sexual desire or something else, what are your suggestions for going about doing that? What's the best way to choose a sex therapist or to find one?
I think certainly when you're looking to licensed professional, looking for licensed mental health professional, assessing what is their training around sexuality, kind of doing a little bit of research on whether it's their area of expertise or not. Because at times, most therapists, they know about relationship, but I believe sex therapy is more specialized work. So even when you're talking about it with the therapist, when you're doing the consult, asking them about experiences around sex therapy, ASAC has this directory of ASAC certified, which is for a sex therapy certification program, the list of the certificate, sex therapists who are certified. But also I think similar to other areas of therapy, the match is really important. You want to feel comfortable that when you're going to a sex therapist, kind of seeing who would resonate with your personality. For example, when I was struggling, first I went to the male therapist to talk about who was a sex therapist. I didn't feel comfortable. He was competent. He was wonderful, but I wasn't able to truly share my struggle with him. So I think big part of it is also kind of seeing who do you feel comfortable sharing this sexual thoughts and intimate experiences that you have.
That's wonderful advice. And I will make sure that we put the link to ASECT. And that's ASECT?
So it's AASECT.org, I think.
Okay, and that's for the American Association of
Sex Therapy and Sexual Educator.
Yeah, and I believe to get that designation too, there's a pretty rigorous process that therapists go through.
Right, it requires supervision and coursework and all of that. So usually people are listed in the website. They also have a good understanding of what sex therapy entails.
And if there are listeners who would like to work with you, Nazanin, or find out more about what you do and the other areas that you specialize in, what's the best way for them to learn more about you and get in touch with you?
So I have my private practice website where I post blog posts. They can find my podcast information there. It's called oasis2care.com. You can find all the information that I put there for psychology of food, sex, drug. If they're specifically interested in my podcast, they can check out my podcast website that's called sexologypodcast.com, that I have all the episodes listed there, and also they can record their question. I answer questions that people have. Of course, it's not therapy, but give them kind of information and guidance around what to do there. And I would love to hear from people, from their feedback, their thoughts that they have, their experiences and challenges that they have. So feel free to shoot me an email. And yes, I love hearing from people. And I'm so grateful, Lourdes, for having me on the show.
Thank you so much. This has been a wonderful conversation. I know that so many listeners will benefit from it. So thank you, Nazanin, for being here today and sharing your time and expertise.
Thank you for allowing me to be here. And this was absolutely wonderful. Have a great day.
You too. Take care. Thanks so much for listening to the Women in Depth podcast. I hope it brings you a deeper understanding of yourself and others, and that you found some insights that illuminated and inspired. You can follow Women in Depth on Facebook and YouTube, and if you haven't yet, please subscribe on iTunes and leave a review. And finally, if you enjoy Women in Depth, please share with a friend. Again, thank you so much for listening, and see you next time.